Let's take a look at early intervention supports and services that we mentioned in Chapter 1 and in more detail in Chapter 3. So in 1968, the Handicapped Children's Early Education Assistance Act set up a model program to demonstrate how early intervention could work. And so this presented some information where we could develop guidelines for how we might approach it in the future. And then in 1968, Public Law 99-457 extended mandated services for children with disabilities from birth to age 6, so beyond elementary school. In 2004, IDEA Part C addresses the needs of children from birth to age 2, and Part B addresses children from ages 3 to 5. So what is early intervention? Early intervention provides sustained support to the family, to caregivers, and to the child with developmental delays and/or disabilities. It's service provided for children birth to age 5, and it addresses the needs of the child and the child's family during pregnancy, infancy, and the pre-kindergarten years. So why does early intervention matter? Early years lay the foundations for future development. The brain grows at a very rapid rate in the first few years. Only used neurons in the brain or cells in the brain will remain, so the right early stimulation matters. So we want to make sure that this stimulation uses the neurons that exist in the brain early in development. Language skills also emerge in early childhood. Early exposure to rich language is important, and this really is a critical period for language development where we can't make up differences if that rich exposure to rich language is not there. And it provides windows of opportunities in early years where learning in a particular area is optimal. It also provides family-centered support, and family-centered early intervention includes working with families as partners, respecting family strengths, their values, and decisions that they've made, while supporting their ability to meet their child's needs. Cultural responsiveness is also key in working with families. Providers should take the time to come to understand a family's cultural background and attitudes in order to proceed effectively. Understanding the family context is critical to understanding the child and providing appropriate supportive services. We also want to provide early intervention in natural environments. And natural environments refer to the practice of facilitating learning through experiences in daily activities and routines, and not in segregated and isolated environments. Most early intervention services are offered in the home setting, as it is the natural environment of the young child. And home visitors may include home health nurses, occupational or physical therapists, and a service coordinator. We also want to detect potential problems, and we can do this so that if early intervention services are needed, that those can be arranged for. So screening for developmental delays and disabilities should begin at birth, and we do this with APGAR tests right directly after birth that's administered in an infant's first few minutes and can detect potential problems. Hearing screenings are also standard for newborns. And then the newborn behavioral observation, or NBO, approach is used to detect special needs of an infant through natural observations. Developmental delays can occur in any of the 5 critical domains: cognitive, communicative, social, emotional, motor, and adaptive behavior. Early intervention seeks to optimize early development and prevent secondary problems from emerging. There are normal variations in infant development and different cultural expectations for developmental milestones. So we have to make sure that we take those things into consideration as we're deciding if a child has developmental delays. So stress can impact a child's development as well and should be addressed by early intervention supports. So there are 3 categories of risk areas for developmental delays. These could come from genetic disorders, from events that happen during pregnancy or at birth, and also environmental factors. Some examples are low birth weight. This would be a full-term pregnancy, but the child weighs less than 5.5 pounds. Prematurity, born before full term, and serious medical complications are all risk factors for delays. Our understanding of genetic disorders continues to grow, and many genetic conditions can be screened before a child is born. Child Find is a legally mandated program that was mandated or required by the Individuals with Disabilities Education Act. Child Find seeks to identify, locate, and evaluate children who may be in need of early intervention or special education services. Females, minorities, and children in poverty are less likely to be identified for services. Once a child has been identified by Child Find, a family member or other provider, assessments must be done to determine eligibility for services. So, what are some of the issues or characteristics that might indicate quality of early childhood services? So, some of the characteristics would be a low student-teacher ratio. That means that there would be more adults per the number of children. The teacher should have higher education levels. There should be positive social interactions, and there should be appropriate academic stimulation. And again, play and developmentally appropriate practices, as we talked about in Chapter 1, is an important part of early intervention. So we want to make sure that we're looking again at the whole child, that we have knowledge of what we should expect according to a child's age, knowledge of the individual child, and meet that individual child's needs with appropriate services and enhancements, and then consider culture and first language. Young children learn best through play, as we talked about earlier, and play comes naturally as children tend to be curious about their environment. Children with disabilities tend to be less curious, more passive, and less adept at using coping skills to meet environmental challenges. So adults have to directly facilitate and support play skills. It's an important part of early intervention. The Individualized Family Service Plan includes 8 components: a statement of why the child qualifies for early intervention services, concerns and priorities the family might have, the family's strengths and resources, the child's level of development, the children's strengths, just like with the IEP, goals and outcomes that are desired, statements of natural environments where early intervention services are provided, and then statements of transition support. So transitions in early childhood, frequent changes in service providers means multiple transitions in early childhood. Transitions can be a time of increased stress, and especially the transition to kindergarten can be especially challenging. So successful transitions require collaboration and support. We want to develop a plan that will make sure that there are smooth transitions, and these are important to ensure that gains made during early intervention are not lost.